Good afternoon and welcome to today's brief on coronavirus situation in the country. Fellow Kenyans, today I want us to address the critical role that is being played by our healthcare workers in this fight against coronavirus disease in the country. Of great importance is the need for infection prevention and control measures to minimize any health risk to healthcare workers and patients' exposure to COVID-19 in our healthcare facilities. I know that we have, on a daily basis, been appreciating them for the difficult work they are doing as our frontline soldiers in this war. The majority of them, if not all, place their duty of service before all and continue to put their lives at risk in order to save the lives of others. Health workers handling patients with confirmed or suspected coronavirus disease face an increased risk of exposure to the virus. Some healthcare workers have indeed become infected with the coronavirus in the course of their duties. The ease of transmission of the virus makes this possible. The occupational health risk of the virus, the occupational health risk to healthcare workers posed by COVID-19 has attracted global and national concern. The government will continue to place extreme importance on protection of healthcare workers by ensuring that they have the right protective gear and, if and when they get infected, that they receive the proper care. Ladies and gentlemen, when health workers are at risk, we are all at risk. COVID-19 infections of healthcare workers have been reported in many countries. Here at home, 450 of our valiant healthcare workers are currently infected, and we have so far lost 4 of them to the disease. Dr. Doreen Lugaliki, who was laid to rest over the past weekend, is the latest loss. May her soul and of all those Kenyans who have succumbed to the virus rest in peace. Yesterday, our team of top officials, led by the Director General of Health, Dr. Aman, from the ministry, visited Pumwani Maternity Hospital, where another 22 healthcare workers have been found to be infected with coronavirus. It is therefore a public health priority for us to understand the risk factors for this vulnerable group to avert further occupational transmission. To achieve the highest level of effectiveness in the response to the COVID-19 outbreak, there is need to use the strategies and practices recommended in the national guidelines and protocols for infection prevention and control of COVID-19 spread. Therefore, it is important to emphasize the role of county and facility infection prevention and control programs with dedicated and trained teams supported by leadership at all levels. It has been noted that transmission of the disease among health workers is associated with overcrowding, lack of established practices of infection control, and poor implementation of infection prevention control guidelines and protocols. Other factors include inadequate training in infection prevention and control measures for both the frontline staff and support staff in health facilities. Lack of this training and knowledge leaves them exposed to respiratory-borne infectious diseases due to lack of personal protective equipment, while in other situations it is the poor understanding of the virus.